going 10 seconds? Okay, we're going in 10. We're going in 5, 4, 3, 2, 1.
Hello, East Baton Rouge Parish. This is your Mayor President, Sharon Weston Broome, and I'm here to update you on our efforts to be proactive with the spread of the coronavirus in Baton Rouge. As of now, we do not have any confirmed cases in East Baton Rouge Parish. However, even if that changes, our preparations and message to the public will be the same. Our goal is to be proactive and to interfere with the natural flow of the outbreak, reducing opportunities for the virus to spread. This is called flattening the curve. You will hear this language in best practices across the country. We have postponed large events and continue to encourage limited social interaction because contact is the biggest factor in the spread of this disease. For the last week, we have been coordinating with our area hospitals and healthcare providers to create a unified healthcare strategy for the coronavirus in our community. Behind me, you see representatives from each of those organizations. Our strategy is focused on reducing the spread of the virus so that our medical facilities are able to care for patients in an efficient way without becoming overwhelmed. Our job is to protect the health and well-being of our residents, which is what we aim to do. The most important thing you can do is to practice everyday health habits. And I know you may get tired of us saying these things over and over. Frequently washing your hands, covering your nose and mouth when you sneeze and cough, and keeping your distance from other individuals. The CDC recommends at least 6 feet. If you are sick, please isolate yourself from others in the community. You should also call your doctor to schedule an appointment. Do not go to the doctor or hospital without calling ahead first. And I now want to bring your attention to this flyer that we have put together thanks to the cooperation and collaboration of our healthcare professionals. It has all of the information that you need to know about the coronavirus and the contact information you need for area healthcare providers. Shortly, we will post this on our website at brla.gov, coronavirus, and we ask the media to do the same. I will now ask the doctors to speak to you about how to best seek help if you believe you are sick. Our healthcare professionals are recommending certain steps, so we are proactive and preventive as much as possible. After our healthcare providers speak, I will come back with additional information surrounding other social and economic issues that we are facing in our community. First, from our healthcare professionals, Dr. Aldo Russo with Ochsner Baton Rouge Medical Center. Second, Dr. Mike Rolfson with the Baton Rouge Clinic Medical Director. And Dr. Louis Minsky will follow, who is the Chief of Staff of Baton Rouge General. He will be followed by Dr. Jimmy Craven, the President of Our Lady of the Lake Physician Group. And lastly, we'll hear from Dr. Don Marcel, the Region 2 Medical Director. Thank you.
Thank you, Mayor. And I want to thank your office for the great support that they have provided us, as well as my colleagues here. We have been working tirelessly for this past week. So the mayor brought up something, how do we flatten the curve? And we have to understand that we have to use what we have in technology-wise to flatten the curve. Each one of us has a platform for telemedicine that is easily accessible 24/7, and you can download it to your smartphone, your tablets, your computers, and you can reach out to a physician through the telemedicine app and obtain consultations through that. So who needs to be reaching out? We want to keep people away from healthcare facilities so they don't get exposed. So people who think that they have been exposed or have some symptoms, it is wise for them to either call your doctor or reach out through the telemedicine application. We have seen at Ochsner an increase, a doubling every day, the numbers of telemedicine consultation that we offer. And we are encouraging our patients, even the ones that have appointments that really don't need to be exposed in to a healthcare facility, to convert their appointments to a televisit so they can stay at home, and that way we can flatten the curve. I want to make an analogy or a comparison that I mentioned to my colleagues the other day. During Katrina, everybody remember what happened during Katrina. We benefited from the electronic records, and those patients that moved around benefited from we could access their records because it was electronically. Telemedicine is our Katrina moment right now, or coronavirus is our Katrina moment for telemedicine. I was talking to one of my colleagues, Dr. Jay Brooks, who lived through many years of electronic records and now with this telemedicine, and he emphasized how important it is for us to use this application for our patients. Now Dr. Rolfson is going to come up.
Thank you, Dr. Russo. I think that I was probably given one of the most difficult questions to go over, and that is, when should you get tested for coronavirus? It's a very complicated question for a number of reasons, so let me go through those. First of all, this time of year, if you have an upper respiratory infection, it's just as likely or even more likely to be the flu or some virus other than corona. So just because you have a cough and a fever doesn't mean you have coronavirus. Therefore, that makes it a little complicated to decide about testing. Secondly, in reality, if you get tested for coronavirus and it's positive, it doesn't change the treatment. It's the same treatment as for a virus or the flu, and that is you stay home, you avoid contact with other people, and you do the typical precautions for a viral illness, plenty of rest, fluids, etc. So it's important to know that even though we do want to test people, you should know the treatment is not changed based on the results of the test. The third thing I want everybody to know is that I think many of you are aware that the State Department of Health came out earlier with recommendations today that anyone in Louisiana with a cough or fever who has a negative flu swab, they should be tested for coronavirus. While in fact, in principle, I guess, the medical community agrees with that, in reality, that's just not possible. As you may be aware, there's a national shortage of the supplies necessary to perform the coronavirus test, and therefore we were unable to do that on everyone with a fever and cough. In addition, you should be aware that the test, while it's fairly simple to perform, it does involve sticking what's called a nasopharyngeal swab through the nostril all the way to the back of the throat, and that can be a bit uncomfortable. It also frequently elicits a cough, and when you have that cough, you can spread the virus to your healthcare provider. Therefore, they have to wear what's called PPE, or personal protective equipment, to prevent spread of the virus. That personal protective equipment is also in short supply. So we're having difficulty performing the test because we don't have adequate supply of the materials needed to do that. So I guess in closing there, it's not an easy decision. While in reality, anyone could have coronavirus if you have cough and fever, it doesn't change the real treatment, and we don't have enough supplies to do it all. So it should be a decision made between you and your healthcare provider. I'm not discouraging treatment. I'm not discouraging testing. I'm just saying the testing is not always as easy as it may sound. I do want to echo what Dr. Russo said, that everyone in Baton Rouge should be proud of the cooperation that we've had between the Mayor's Office, the State Department of Health, and all of your community healthcare providers. It's been a wonderful cooperative effort to get this program together. And with that, I think I turn over to Dr. Minsky from Baton Rouge General.
Thank you, Dr. Rolfson. Thank you, Mayor. It is a pleasure to be able to work with so many of the physician leadership from the other institutions, and for the Mayor to offer an open door policy that we could come in and lend our expertise in this very difficult time. But let's not forget that while we're concerned about the coronavirus, we cannot forget that there are chronic illnesses, and all of us are wondering, so what does this mean for me as a patient who have other medical problems? And you should keep your appointments to your doctor's office. You should follow through with any routine visits that you've already scheduled. People have diabetes, people have asthma, people have heart disease, and these diseases, if left unchecked, can precipitate acute illnesses that are very severe, require hospitalization, more medication, sickness, time out of the home, exposure to other infections in the community, perhaps by an emergency room visit or bus. So we know that we feel like right now that coronavirus is the reality, but we cannot put our own health and chronic problems aside. We want to encourage everyone, again, I don't think we'll repeat it enough, and we'll all say it, that you need to wash your hands, keep your face free of hands and contact, clean household surfaces, and limit socialization. Avoid as much contact as you can. Learn to do the elbow bump if you have to give one of those Louisiana welcomes. We just can't hug and kiss like we used to. We're asking, again, for everyone who's sick before you present to the emergency room or clinic to please call. Let us know you're coming because we want to be prepared. We're not asking you not to come. We want to make sure that you're protected and those that you may be exposed to are also protected. Again, I can't emphasize enough that because the coronavirus is here, that we can risk our chronic conditions being put on the back burner. The good news is, and there is good news in all of this, there's a world out there of countries that have been exposed to this virus already. They're already searching treatments, and they're already planning actions to take care of their people. We have states in our own United States also that are learning from each other, and we have the ability, having no viruses here in the city as of yet, that we can learn from them and we can be prepared. And if we're going to flatten that curve, we have to do everything in our possible hands, by washing those hands, so that we can prevent the spread. Thank you, and I think Dr. Craven, you're next.
Thank you. Through this process of working together, there's been plenty of questions regarding elective surgeries in the community. As of right now, healthcare facilities are proceeding with all appointments and elective surgeries as scheduled. As the mayor has said, and as you know, there are no cases in our community today, but we are prepared whenever that should occur. We strongly encourage you not to cancel your appointments because one of the best protections we have against this virus is to be as healthy as we can be right now. As a collaborative team, we're in constant communication with our LDH partners and working to ensure the safety of every patient, guest, and employee, and to make decisions based on evolving facts and community well-being. Our hospitals and clinics are open and safe. If individuals are concerned about their upcoming procedures, then speak with your doctor about the best plan for their situation. Thank you.
And lastly, I'd just like to address visitor restriction. This is in line with everything else that has been said by the physicians. Right now, we have no cases. We are proceeding with elective cases and do continue to see your doctor for previously scheduled appointments for management of chronic conditions. However, with LDH, in an effort, along with all of our other partners, in an effort to flatten the curve and contain and mitigate coronavirus in our community, we are recommending visitor restriction. That is not no visitation, but it is visitor restriction. So being sure that if you have a fever, if you know you're sick, that you don't go and visit people who are in the hospital and are ill and compromised, not just for your loved one, but for other people's loved ones as well, and even for yourself and for the healthcare providers who are there to keep everyone else well. There are guidelines and clear guidelines and directions and recommendations on our website at ldhla.gov, and I encourage you to go to those to read them and review them, as well as look at each institution and their policies and procedures to honor what is happening where you will be visiting. Lastly, I would like to share that LDH has 211. You can call 211. We have joined forces so that non-clinical people who have questions about coronavirus can call 211 and get information about that is the most up-to-date at the time as this is evolving. In addition, you can text LACOVID in all caps, Louisiana COVID, LACOVID to 898-211, and that will send you texts regarding the most up-to-date LDH information, and you can have that available to you as well. Thank you.
So thank you to all of our physicians and our hospitals for your cooperation and collaboration in this effort. Let me just share this. Our goal here is to be proactive and preventative. We are not being reactive, we are being proactive. And so you might say, well, you're giving us a deluge of information, and that's because we want to be on the safe side and prepared, as you are supposed to be in any crisis or emergency. Now, some other conversations that I have had have certainly surrounded the economic impact of the coronavirus, as well as some of the social concerns. So I want to share several things with you. First, let me just say I want to thank our council members for their cooperation and attendance and support as we've worked through this issue. Today we have council members Dwight Hudson, Wicker, and Green with us. We have our constable, Terica Williams, also with us. So thank you all for your support. Today, I want to let you know that I have signed an executive order restricting all city-parish travel until further notice. In addition, I have signed an administrative regulation leave policy specific to COVID-19, providing for telework and other arrangements for city-parish employees. And I have to pause and thank our tireless working city-parish employees for all that you do. Thirdly, I will be signing an executive order aligned with the Public Service Commission to ensure that there are no water shutoffs that occur in East Baton Rouge Parish. This is to ensure that our local ordinances do not conflict with the PSC executive order. Now to talk a little bit about our economic challenges and how we're working through them. We have members from the business community, Adam Knapp, as well as John Ureldes, who is part of my mayor's business roundtable, who will speak to those issues. We also have other community members who are joining us who represent various spheres of our community, including John Spain from the Baton Rouge Area Foundation, Paul Arrigo from Visit Baton Rouge, Jerry Jones from the North Baton Rouge Economic Development District, Renee Shadolin from the Arts Council, Davis Rohr from the Downtown Development District, Peter Scalfani who is the chair of the Louisiana Restaurant Association, and Ben Blackwell, who is the past president of the Baton Rouge Lodging Association. I'm going to ask Adam and Jim to come to the podium now.
Mayor, thank you. Appreciate your leadership on behalf of the business community. We want to share a few pieces of information with everyone about how businesses can be preparing in this time. As has been said here, the impacts of coronavirus are requiring businesses, of course, to adjust practices. My office, like most offices this week, have had meetings with our teams to prepare our employees for all the eventualities that we can so far try to get ready for. And so in trying to help employers to have the same kinds of readiness and information, we've put together information that is a tool and a resource for businesses on our website. There are many organizations behind us and nationally who are putting out incredibly useful information, and we are trying to make sure we are aggregating quite a lot of that guidance for employers into a single location to be able to share those links. On our website, which is brac.org, brac.org/recovery, you'll see a lot of the information I'm going to talk about just in a moment. The guidance that is available from the CDC remains the best and most important guidance for employers to be prepared for. The U.S. Chamber of Commerce nationally has been also doing the same. All of those links are available on our website. The short list of guidance today that we just want to make sure we call attention to for employers follow in keeping with what you have been hearing already in this press conference. One is to make sure that employers establish personal hygiene practices for all their employees that are consistent with that CDC guidance regarding topics such as surface cleaning, hand washing, and social distancing. Second is to make sure that employers review and update your employee travel and meeting policies, both internal and external meetings, regarding how you're going to make sure you host those meetings or preclude any travel that is unnecessary, and to make sure if it's possible to handle those virtually or remotely. Third is to review your office sick leave policies to determine if any changes need to be made accordingly.
Fourth is to prepare for a remote work plan should you need one, and the capabilities that you need to be able to have in accordance with that. Try to do so in writing to share with your employees what that policy is, if one needs to be changed regarding remote work or set in place if it is necessary for your office. And finally, with regard to this, prepare and share with your teams about quarantine or self-quarantine policies and any potential office closure policies, and doing so when possible in writing. We saw, of course, the President announce that disaster business loans would be made available through the Federal Small Business Administration. The available information is now starting to come out today. The SBA is going to work directly with state governors and mayors to provide targeted low-interest loans to small businesses and to nonprofits that have been severely impacted by COVID-19 coronavirus. The SBA's Economic Injury Disaster Loan Program is available historically after natural disasters and other disasters, has now been made available. That information is available on the SBA website. It provides working capital loans to businesses of up to $2 million for vital economic support to small businesses to help overcome the temporary loss of revenue that they might perhaps experience. Information can be found out on the Economic Injury Disaster Loan Program on the SBA's website, which is sba.gov/disaster. Again, that's sba.gov/disaster. The Baton Rouge area the Baton Rouge area Chamber today is releasing a COVID-19 business survey in order to seek to understand how businesses are being impacted, so that we can provide guidance to our elected officials and to the public about the impact to employers, both how they are feeling the impact of that, as well as the economic impact to our region and to our community. If you are a business owner and you'd like to complete that survey, please go to brac.org/recovery to take the business survey. You will also find it available on our Facebook page for the Baton Rouge Area Chamber. And finally, in preparation for the possibility that you might have an employee of your company that has been impacted by COVID-19 and you would like to provide grants to your employees, employers can set up accounts on employeesfirst.org. I'm going to read that again, employees1st.org, in order to make tax-deductible donations to a fund that can be used to distribute funds as direct grants to employees who perhaps might be impacted. Thank you.
Thank you, Mayor, for this opportunity. Really speaking on behalf of the restaurant and the hospitality industry, which is 1 in 10 jobs in the state of Louisiana and throughout the country. And I was talking with Peter Scafani that the LRA.org is putting updates from the national level and the state level about things that all restaurants can do. I think the hospitality industry in the state of Louisiana has a reputation for always being a leader, and our hospitality here is far non-comparable to any other state. But we take a lot of pride in the fact that our restaurants are cleaned on a regular basis, and I think we all have gone a little bit more aggressively to make sure and assure the public that all restaurants are doing their best efforts to make sure that everything is safe. You know, we were a little saddened with the loss of the fund this weekend, but we understand that there's a bigger concern out there right now. But I do encourage the public to remember that a lot of the restaurants and bars have really, you know, up their inventory, and then they were trying to prepare for something big. So if you can, I do appreciate that you would support local, whether it's eating, dining, or shopping. It's from the backbone of the economy here, and we can all do our best just to, you know, try and stay local as possible. And also just to wash your hands every time you enter a restaurant or the restroom. Same with all employees, but just everybody doing their best effort to, you know, keep things as normal as possible, but still go out and support your local economy. Thank you.
Thank you, Jim. Indeed, we want to continue to support our local economy, and I am practicing that on a daily basis with restaurants in our local area. I just want to share that. I also want to thank Councilwoman Rocca for joining us as well. It's my understanding, before we take questions, that there has been an account that has been set up through the Baton Rouge Area Foundation to help support organizations like the Baton Rouge Area Food Bank that may be inundated with requests, and other nonprofit entities like that. So indeed, if you are interested in supporting the food bank and other organizations, the Baton Rouge Area Foundation will be assuming the role of donations for those organizations. In closing, let me just say this. Once again, thank you to our medical community, our business community, everyone who has assembled here today. There will be other information coming out. As you know, the governor is about to give a press conference as well, and some of that information has already been put out through social media, and we are certainly aligned and in collaboration not only with the state but with our school system as well, recognizing that there is a shift that is taking place there. In closing, let me just say our approach is one of concern and care for our community. We don't want anyone to panic. We want everyone to stay calm, but it is our responsibility, it is my responsibility as the leader of the city and parish to make sure that we are prepared no matter what happens. So thank you, and God bless you.
Mayor, this question is for you. It could be for Adam Knapp as well, and for the guy with the restaurant industry. You know, as you mentioned, the governor just made an announcement that all K-12 schools will be closed for about a month. That will have various impacts on families, employees. Maybe some people can't get off work. They're having to figure out what to do with their children. What have you been telling your employees who may be impacted by this? Adam, have you been talking to businesses? What have they been telling you about this as well?
Well, I'll start with my role as mayor president and for the city parish. As I shared with you earlier, that I signed an administrative regulation leave policy and a policy surrounding COVID-19. And so this policy that I signed is certainly one that is a compassionate policy. I have directed my department heads to be lenient, flexible, and compassionate with our employees. And so as I shared with you, we are already prepared for telework, and as our employees bring up various issues that they may have, whether it's with childcare, et cetera, we're going to certainly implement a very understanding and compassionate approach, and we have that included in our document.
Mayor, can you explain the three executive orders that you signed, especially that travel one, restricting the travel? What is that?
Well, it's not too far removed from others that you've heard. I'm just asking our city parish employees not to pursue any out-of-state travel. It's very simple. That's it.
Any other two? What were the other two?
I'm sorry. The other two was the one that I just shared with you, the administrative regulation leave policy. That has to do with our employees and their leave. And the third one is that I will be signing an executive order with the Public Service Commission to ensure that there are no water shutoffs.
And also, too, so what's kind of the step-by-step? Let's say if, and it's probably not winter, if we get a case of coronavirus in Baton Rouge, what is the first step with doctors? Will they be quarantined? How will you guys handle the first case of coronavirus here, basically by an hour-by-hour basis? How will that work?
Okay, so I'm going to ask Dr. O'Neill to step up to the plate now. She is an infectious disease specialist, and that is her wheelhouse right there. So, Dr. O'Neill.
Thank you, Mayor. So we are already isolating patients with respiratory symptoms. When a patient comes into a doctor's office or into the hospital with fever, cough, chest pain, sore throat, we are giving them a mask, which is the first line of defense. And all of the area hospitals and clinics have been doing that for several weeks now. We're used to doing that in flu season, so we stepped up our questionnaires. Right now with visitor screening, we're also asking visitors. Once that patient comes into the clinic or into the hospital, they are assessed. They may be worked up for the flu, or their healthcare provider may choose to isolate them for COVID-19 at that time, depending on that assessment. If you have a stomach ache, you may be assessed for appendicitis. So you'll get an assessment, and then they'll decide what the next step is. If somebody thinks you have COVID-19 today, long before the test ever comes back, you're isolated from the rest of the patients in the hospital, and your team starts to wear the PPE necessary to protect them as they care for you. So while we have sent tests to the state to rule people out, we have not had a positive test, but we have been isolating patients and making sure we're doing the right thing in case they come back with coronavirus. That's happening now, and I think you've heard about some of those cases. We've had all negative tests thus far, but we're already prepared because we've begun those processes of isolating patients, ruling them out, and making sure that we're safe for everybody.
And where can people go to get tested if they so choose?
That's a great question. As you know, over the last couple of weeks, the testing criteria have changed. So we were testing only inpatients and people who met the definition put forth by the state. Now that we have these reference labs who have put their tests online, and now that we have the guidance from LDH today saying that people who meet those criteria can get tested, you should call your doctor's office first if you have those criteria, and let your doctor's office guide you to the appropriate testing facility. And hopefully you have information in front of you that will help to guide those patients. But to get a test, you need a doctor's order. So if you have those symptoms, you need to call your doctor and let them guide you towards care and towards testing.
Another question?
We've seen things with this virus change very rapidly in terms of everyone's response to it. So in the days to come, like we're getting ready to head into a weekend, what things have you guys put in place in the city parish level in terms of trying to mitigate your response to this, maybe for public facilities or with employees on now on calls? What does that mean in terms of trying to respond to whatever the public's needs may be as this thing progresses and changes over the next course?
So we operate from the same framework that we operate with any crisis or emergency, and that is from the Mayor's Office of Homeland Security and Emergency Preparedness. So the Director of Emergency Preparedness, Clay Reeves, has a protocol in place in terms of responding to every situation that might occur in a crisis, but specifically now prepared for the coronavirus. And so that not only includes, of course, our Office of Homeland Security and Emergency Preparedness, but it also means collaboration with our public safety team as well, EMS, et cetera. So we just had a unified, I would call it unified command or unified leadership meeting where we all talked about everyone's responsibilities, what each department would be responsible for, what their needs might be, and how we're responding. So we do have that in place, and it is under the leadership primarily of MOSEP. Did you still want to talk with the
The short answer is this is hours fresh. It's still very new information about the school closures, and so to be able to speak to the impact to the business community will be difficult to do in a short time frame. The two things that I want to mention that I said earlier, I think are partly as a result of what we have been observing in our own office that I think is probably consistent with a lot of offices. One is which the remote work capabilities become necessary, especially if there is a necessity of somebody to be there, as the mayor pointed out, out of compassion to be able to be a provider to their children, but also to be able to be on as an employee. Those capabilities become very important. The second thing is we're releasing the business survey, intending to try to gather a lot of that kind of information in response to be able to understand in real time as much as we can the experience that's happening at employer sites of all sizes. The last thing I want to end with is just it is very important, while remaining as cautious as possible, to keep the economy moving. And so to keep the economy moving, we need to make sure that we're thinking smart about how to make sure that employers can stay open and do business while also making sure they're keeping conscientious and safe. Thank you.
Mayor, I'm sorry. At this point, all of city parish offices and services are available to everyone out there in Maine 7 at this point?
At this point, they are available. I will say this. We anticipate some closures with Head Start because our Head Start mirrors the school system.
I wanted to ask you about, I know that you had a meeting earlier today with the 3 other mayors in East Baton Rouge Parish. We got a statement from the mayor of Central, David Barra, and said that y'all had agreed that closing the schools here at this point wasn't a good idea. And then not long after
Yeah, I'm sure the governor made an informed and meaningful and insightful decision. And what's most important is that we all work together to make this work. Any other questions for anybody else?
Mayor, just going off of the school closures, just in the past few days, we've kind of seen an uptick in crime. There was the past 48 hours, a few days ago, where there was 4 homicides. There's multiple arsons overnight, last night. What are you guys trying to do with school being out for a month, trying to mitigate that and make sure that doesn't become a long-term trend?
Well, I never look forward and anticipate crime being a long-term trend. Our Baton Rouge Police Department is actively addressing those recent issues that happened, and it is in line with the plan of action that Chief Murphy Paul has to keep the community engaged so that they can help us respond to those needs. For example, you've probably heard time and time again that our rates have increased in terms of finding out who are committing these crimes, right? And that has happened because of the support of the community. So we anticipate that increasing, but also our police will be out on the street. We have a very vibrant community policing department that are engaged with our young people on a regular basis. So I believe that continued collaboration with our nonprofit organizations, law enforcement, those individuals who are involved with youth on some type of consistent basis will help us work through the next couple of weeks.
Take one more question. How much money will local businesses that are on the parade route for St. Patrick's Day this weekend, how much, I don't know if this is a question for your local businesses, it's going to definitely be a hit to them. I know financially, I know they've been preparing. I think you saw like iBars is bringing extra beers. I know Jim posts on Facebook about, hey, you know, support your local businesses, but this is something that they've been looking forward to all year this weekend. What's kind of your response to that?
Well, my response is, as the mayor president of this city and parish, I have to do and make the tough decisions on what I believe is best for this entire community. Now, let's weigh that against the backdrop of having an outbreak of a virus or someone having a beer. I want to make sure that we minimize the opportunity for this virus to continue. I understand, and you just heard from some of our business community about the economic impact. I get that, but we have to weigh that against the backdrop of something that could be more voluminous, that could certainly impact us economically, maybe not for 2 months, but for 6 months if we don't get a grip on it. So certainly I understand the challenges of our local businesses. That's why I asked them to come and speak. I'm encouraging people, when you can, get out there and support our businesses. Go get breakfast like I did this morning and brought food to our administration. Do those things. Continue to support them. But remember, our message, which the organizers, by the way, of the parade, St. Patrick's Day Parade, were in agreement with, that we made the right decision, is that we want to minimize the contact that takes place in large crowds. I just read an article that someone passed on to me about what happened in 1918 with the Spanish flu and how that got out of control because of the large crowds that were there. And I see my doctors nodding their heads. So we don't want to put ourselves in a vulnerable position like that. My encouragement is, I believe that we will recover from the economic impact of a parade like the St. Patrick's Day Parade. But I want to do everything possible to save lives. That's so vitally important. I want to make sure that our citizens are taken care of, that we minimize this risk, and that's part of the tough decision. A tough decision, but I believe